It's a healthy diet and exercise that Lorna uses to help control her weight these days. She had tried one of the brands of weight loss jabs, which she bought online, and was initially thrilled to be losing 3 to 4 pounds a week. Then one night she suffered what doctors believe was a side effect to the drug, an inflamed pancreas that needed hospital treatment and surgery to remove her gallbladder.
My legs were shaking, the pain. Oh God, it was horrific.
Now she says the jabs just aren't worth the risk.
I went to bed absolutely fine, completely normal. And then 2 o'clock in the morning, I just woke up with horrendous pain in my stomach. I was sick because of the pain. I was getting a fever. You know, I was curled over with pain in my stomach. It was like someone had just stabbed me in my stomach.
Lorna's not alone, according to new data from the UK's medicines regulator. It found 181 cases of pancreatitis linked to Mounjaro. 5 people died. And there were 113 cases of pancreatitis linked to Ozempic and Wegovy. 1 person died. There's no evidence the drugs directly cause the deaths, and people who don't use the drugs can also develop pancreas problems. But the medicines regulator is starting a new study to see if some people have genes that predispose them to potentially dangerous side effects. This scientist says the risks are higher in people who are using the jabs as a lifestyle choice.
The risks associated with being obese far outweigh any risk associated with these drugs. They're not drugs for aesthetic reasons. It's not a new weight loss fad. This is a medication in the same way that people would take blood pressure medication or painkillers. These are medications used to treat the disease of obesity.
Eli Lilly, the manufacturer of Mounjaro, said patient safety was its top priority. It said adverse events could be caused by other factors, including pre-existing conditions. Novo Nordisk, the manufacturer of Ozempic and Wegovy, recommended patients take weight loss drugs only for their approved purpose and under strict supervision of a healthcare professional. But Lorna says her experience should be a warning to all.
I've got friends now that are, you know, going on it, knowing what's happened to me, but they just want to be small, they just want to lose the weight, they just want to feel nice again. And I'm constantly going around saying, you know, don't do it, it's just not worth it.
More than 1 million people are now on weight loss jabs with astonishing health benefits for people with obesity and type 2 diabetes. But they have become a social phenomenon, and that makes some doctors uneasy. Thomas Moore, Sky News.